Good day, everyone. Today, I am presenting a comprehensive research analysis on what I argue is the most urgent ethical dilemma facing the U.S. Federal government at this present time, should the federal government guarantee access to mental health care for all Americans? As we navigate the complexities of modern public policy, the intersection of healthcare, infrastructure, and federal responsibility has moved to the forefront of national discourse. Over the next 8 to 10 minutes, I will dissect the historical context of mental health policy in the U.S., analyze the competing cultural and political factions surrounding this issue, and propose a concrete, structured federal policy intervention. And finally, I will evaluate how this solution balances the principles of personal and social responsibility to benefit the nation as a whole. So let's begin. To understand this dilemma, we must first look at who it impacts and how history brought us here. Millions of Americans suffer from treatable mental health conditions yearly, yet structural barriers such as provider shortages, astronomical out of pocket costs, and fragmented infrastructure leave a vast portion of the population without any care. While mental illnesses affect individuals across every demographic, this crisis falls heaviest on low income families who cannot provide private care, who cannot get any private care, rural communities devoid of local providers, and veterans adjusting to civilian life as well. Historically, the U.S. handled mental health care through a cycle of structural shifts. In the 19th and early 20th centuries, the approach relied on centralized state institutions. The mid 20th century brought a wave of deinstitutionalization, accelerated by the Community Mental Health Act of 1963. This aimed to move to community based centers. However, the community centers were never adequately funded, leading to widespread homelessness and the criminalization of mental illnesses. And as of recent, the Mental Health Parity and Addiction Equity Act of 2008 attempted to force commercial insurers to cover mental health equally to physical health, but commercial network gaps and enforcement loopholes remain rampant. Why is this the most crucial issue as of right now? Why do I argue that, really? Because mental health is a fundamental, foundational to every other civic system. You cannot fix educational disparities, stabilize the housing crisis, or reform the criminal justice system without addressing the underlying mental health crisis first. It is a systematic issue that undercuts the stability of our entire social fabric, making it a primary ethical obligation for the federal government. When examining the societal landscape of this issue, a sharp division emerges regarding the mechanism of delivery. My analysis argues that the U.S. government must take an intervention. This intervention stance is to ensure care. My perspective simply is heavily supported by social, cultural, and medical organizations across the country. Groups like American Psychological Association and the National Alliance on Mental Illness advocate strongly for federal intervention. Their reasoning is rooted in public health data. They argue mental health is a public good, much like public education or infrastructure, and leaving it entirely to an unregulated market results in systematic failure, which we are currently seeing. Politically, this aligns with coalitions that view healthcare access as a fundamental right necessary for equal opportunity. Conversely, significant opposition exists within the U.S. society, driven primarily by fiscal conservative groups, libertarian think tanks, and certain private insurance organizations. Their primary reasoning centers on economic scope of federal intervention and the principle of limited government. This is entirely backwards. None of this makes sense. They argue that a federal guarantee would trigger massive budgetary expansion, require a increased taxation, and lead to bureaucratic inefficiencies, which overall could be lower. Furthermore, they assert that healthcare decisions should remain strictly between private individuals and commercial markets, viewing extensive federal mandates as an overreach into state jurisdictions and private enterprise. Understanding in the opposing rationales is essential for crafting a viable solution. My proposed resolution to this whole ethical dilemma, I propose a concrete legislative act, the passage of a comprehensive congressional statute titled the Mental Health Infrastructure and Access Act, amending the Foundational Public Health Service Act rather than completely upending the existing private insurance market, which faces a whole big hill to climb. This law targets the structural root of the problem by utilizing the established federal framework of certified community behavioral health clinics. This act would be appropriate a permanent federal funding to build, expand, and appropriate these clinics in every county of the U.S. These clinics are federally mandated to provide comprehensive evidence-based mental health care, substance use services to anyone. Furthermore, the policy directly tackles the seven-nation provider shortage. It establishes a robust federal stipend and tuition forgiveness program. It would utilize licensed healthcare professionals like psychologists, professional counselors, social workers, who could commit to working a minimum of 4 years with the expanded community clinical network, specifically targeted rural and urban low-income areas. By expanding the physical clinics and building the professional workforce simultaneously, this policy ensures that an actionable universal tier of mental health care becomes immediate towards all Americans. Any policy of this magnitude will face rigorous objections, the most prominent being fiscal. Critics will ask, how can we justify adding billions to the federal budget? My counterargument to this is grounded in macroeconomic realities. You have to understand that untreated mental health conditions currently cost in the United States an estimate of $300 billion annually due to lost workplace productivity, overutilization of emergency medical rooms for psychiatric crises, and the immense cost of housing for some of these individuals with untreated illnesses within our correctional facilities currently. Investing in a robust community-based prevention infrastructure shifts federal spending from reactive, high-cost emergency management to proactive, cost-effective maintenance. This is all my idea. This policy beautifully reconciles the tension between personal and social responsibility. Opponents will argue that mental health is a matter of personal responsibility. Sure, I agree. That individuals should seek out and manage their own care, 100%. However, personal responsibility cannot exist in a vacuum. If a person wants to seek help but lives in a county with zero available providers, well then, how are they going to seek that on their own? Once the infrastructure is secure, the elements of personal responsibility is activated. Individuals are empowered to utilize these resources, engage with professionals, and take charge of their own health. Ultimately, this federal action yields a profound net benefit for the American people and ensures a healthier, more resilient workforce, reduces the strain on local law enforcement, and closes the healthcare gap for marginalized populations, thereby elevating the standard of living and preserving human dignity nationwide. To conclude this presentation, it is built upon all my data extracted from peer-reviewed research, public health metrics, and foundational federal reports. This includes publications from the American Psychological Association and National Alliance on Mental Illnesses, detailing current systematic gaps, official data from the Substance Abuse and Mental Health Services Administration evaluating the clinical efficacy of community health clinics, and peer-reviewed health economics literature, assessing the long-term societal and economical cost of untreated mental illnesses. By implementing structured, targeted legislation action, the U.S. federal government can fulfill its ethical obligation to protect the welfare of its citizens. This will ensure a stronger, healthier nation overall. I thank you for your time. Welcome. Thank you so much. Any questions or discussion on this is welcome. Thank you.